Have you ever noticed there's something a lot of people do with the best intentions, and the knee still doesn't get better? The person feels their knee stiff, tender, sometimes even swollen, and thinks, I need to stretch. So they stretch before walking, stretch after, stretch when they wake up. And even so, when it's time to stand up from a chair, go downstairs, get into the car, the knee keeps complaining. Or worse, it feels like after stretching, it gets even more irritated. And what if I told you that for many people over 60, the problem isn't a lack of stretching, it's the type of stretching they're doing, and especially the habit of stretching to the limit, like forcing it, is the solution. Today I'm going to show you 3 super common stretches that might be making your knee pain worse without you realizing it. And more importantly, I'll teach you what to do instead. 3 mobility exercises to wake up the joint safely. And at the end, 1 stability exercise that puts the work back on the right muscles, so walking can start helping again. Stick with me until the end, because those last 2 parts can change your walk today. Now help me out. Comment yes if you feel knee pain or no if you don't, and write your age. That shows me who I'm talking to, so I can bring the right exercises for you. But first I need to break an idea that keeps a lot of people stuck in pain. And I say this as a physical therapist who treats sensitive knees pretty much every week. A lot of people believe that if the knee hurts, it's because it's tight. So the solution would be to pull harder and chase the maximum range of motion possible. But after 60, when the knee is already more sensitive, that strategy can make things worse instead of better. Because stretching to the limit, that pull until it touches, push a little more kind of stretch, often isn't teaching the knee to move better. It may just be putting the joint into a more compressed position, irritating structures that are already reactive, especially if there's inflammation, osteoarthritis, joint effusion, fluid, or sensitivity at the front of the knee. What the knee usually needs first isn't more range at any cost. It's mobility with control. Mobility is different from aggressive stretching. Mobility is movement within a comfortable range with gentleness, repetition, and circulation, like you're waking up the joint. That kind of movement reduces stiffness, improves the knee's tracking, and prepares the body to walk without picking a fight with it. And this isn't just my opinion. International guidelines for non-surgical management of knee osteoarthritis place education and structured exercise programs as core treatments. All right? Now, I'm going to show you 3 very common stretches I see every week, people doing them with the best intentions. But after 50 or 60, when the knee is more sensitive, they can irritate instead of help. And first, this doesn't mean these stretches are banned forever. The point is, if your knee is reactive, the how and the when make all the difference. And you'll learn in a second how to identify that. Stretch 1. Quads, pulling your foot back until it touches your butt. This one's a classic. You stand up, bend your knee, grab your foot with your hand, and pull it back. And the more you pull, the more you feel it hit. The problem is that for many people with pain at the front of the knee, this puts the knee into very deep flexion and can increase compression in the anterior area, exactly where it's often already sensitive. And then a very typical pattern happens. You stretch, feel momentary relief because you loosened it. But later, you notice the knee gets more irritated when going downstairs, standing up from a chair, or walking. Signs this stretch is working against you. You feel discomfort at the front of the knee during the stretch, or the knee feels more full, warm, or sensitive afterward, or symptoms worsen over the next 24 hours, more stiffness and pain during simple activities. A quick adjustment, without getting into mobility yet, is to not stretch all the way. Reduce the range, and pay attention to thigh alignment. Don't let your hip drop or your spine twist just to force the stretch to the maximum. The goal is not to get your heel to your butt. The goal is to stretch with comfort for your knee. If you have to force it, you've already gone too far. Stretch 2. Hamstrings, locked knee, and rounded spine trying to touch your foot. This one is also very common. The person straightens the leg, locks the knee, holds their breath, and goes for it, trying to reach the foot. Usually, the spine rounds and the whole body gets tense. The problem here is that it turns into a fight. Instead of gaining movement with control, you create tension through the entire posterior chain. And when your body goes into that tension, the knee often loses its natural flow. It gets stiffer, and your walk afterward can actually get worse because you leave the stretch more locked up than when you started. Signs this is you. You feel like you have to push and hold your breath. You feel sore afterward, not looser. You feel a strong pull behind the knee, or your walk feels stiffer. Quick fix: stop locking the knee at the end range. A slight bend and calm breathing change everything. If the goal is to prepare for walking, not to prove flexibility. With each exhale, ease a little further, and you can do it seated, which often helps you stay comfortable and avoid overdoing it. Stretch 3. Deep squat as a stretch, dropping all the way down and holding it. A lot of people do this like it's a knee stretch. They sink really low and just stay there, and sometimes it even feels like it loosens things up. But for a sensitive knee after 50 or 60, that position can put a lot of load into a deep bend. And if you don't have enough strength and control yet, the joint takes too much pressure. Result? You stand up and the knee feels more irritated, especially going downstairs or walking afterward. Warning signs: pain while you're down there, a pressure feeling at the front of the knee, worse symptoms over the next 24 hours, especially stiffness and pain when standing up. Quick fix: if you're going to do it, drastically reduce the depth, or simply don't use it as prep for walking when your knee is reactive. Now here's the golden rule I use with my physio patients. If a stretch increases your pain afterward, or makes things worse over the next 24 hours, it's not helping you right now. That's why, instead of stretching to the limit, we're going to swap it for a better strategy for sensitive knees. Comfortable, repeated mobility to wake up the joint without irritating it. Now let's get to the part that helps a lot when the knee feels stiff or sensitive: controlled mobility. The idea here isn't to stretch to the max and pull to the end. It's to wake up the joints and prepare your body to walk with less irritation. And I like this sequence because it's simple, fast, and you can do it at home before heading out, in 2 or 3 minutes. First, ankle mobility at the wall, because a locked-up ankle makes the knee pay the price. Face a wall and place both hands on it. Put one foot forward, firmly planted on the floor. Now glide your knee toward the wall and back slowly, like a gentle back and forth. The most important detail is keeping your heel glued to the floor the whole time. If your heel lifts, you stop mobilizing the ankle and start compensating instead. Do 8 to 12 reps, then switch legs. A lot of people immediately feel their stride get lighter just from this, because the ankle frees up and the knee stops twisting or forcing to compensate. Next, knee extension on a chair, a safe way to wake up the movement without irritating anything. Sit on a sturdy chair in a comfortable posture. With your foot on the floor, slowly straighten one leg as far as is comfortable, hold for a second, and come back down. Don't kick fast and don't aggressively lock out at the top. It's controlled, like you're teaching the knee to glide and trust movement again. Do 8 to 10 reps on one side, then the other. The sign you're doing it right is feeling the knee get looser with each rep, without any sharp twinge. And now the mobility drill that a lot of people feel right away because it improves the knee's tracking sensation, controlled rotation, both bilateral and single leg in the same exercise. Stand with your hands lightly on a wall or the back of a chair just for safety and keep your knees slightly bent. First, do both knees at the same time. Draw small circles, really small, like you're lubricating the joint. 20 seconds one direction, 20 seconds the other. The rule is simple. Short range, no sharp pain, no forcing. Then go single leg with more control. Shift more weight onto one leg, keep that knee slightly bent, and repeat those small circles on that side only for 15 to 20 seconds. Switch and do the other side. It's subtle but powerful, because it wakes up control around the knee and hip without you having to pull anything. Just be careful not to turn it into a twist. The foot stays planted and the circle stays small and smooth, like you're just waking up the joint. Done. This sequence isn't to tire you out. It's to prepare you. In just a couple of minutes, you take the knee out of locked mode and put it back into working mode. And now comes the step that changes everything. Mobility wakes up the joint. But stability is what makes walking start to feel good for real. Now we get to the part that really changes the game, especially after 60. Stability. Mobility wakes up the joint, but stability is what makes the knee feel protected while you walk. Because when the right muscles aren't doing the job, the knee tries to compensate, and then walking turns into irritation. So I want to give you one simple, safe, and very effective exercise that I use with a lot of people in the clinic, specifically, to improve that sense of steadiness. You're going to do the wall mini squat. Lean your back against a wall, feet hip-width apart. And here's the adjustment that changes everything. Your feet should be slightly forward, not glued to the wall. If your feet are too close, the knee takes more load and can get cranky. So step them a bit forward, like you're creating a more comfortable track for the knee to work in. Now you'll lower just a little, like you're sitting in the air, and come back up. This is not a deep squat. It's short, controlled, and unhurried. Think of it as training the knee to bend with alignment and safety, not proving strength. The secret is feeling your thigh and glute working while the knee stays steady. If you feel only the knee and nothing in the muscles, the range is too big, or you're losing control. As you do it, keep two simple rules. Knees track the same direction as your feet, pointing toward the second and third toes, not collapsing inward. Weight stays through the midfoot and heel, not all on the toes. This helps reduce that impact feeling at the front of the knee and gives you more stability for walking. Do 2 sets of 6 to 10 reps. And if your knee is more sensitive today, start with a smaller range and fewer reps. Here, quality matters more than quantity. The goal is to finish feeling the knee more reliable, not more irritated. And a tip I really like. After those 2 sets, stand up, take a few steps around the house, and notice the difference. A lot of people feel their walk get more stable right away because the body finally switches on the muscles that should be protecting the knee all the time. So how do you use this in a simple way without making your life complicated? Before walking, do those mobility moves for 2 or 3 minutes to wake up the ankle and knee. Then do 2 sets of the wall mini squat. That's it. Then go for your walk with a knee that's more ready, less stiff, and better supported by muscle. The worst-case scenario for the knee after 60 isn't missing a perfect goal. The worst-case scenario is fear pushing you into a sedentary routine. Because the less you move, the stiffer your body gets, the more your muscles switch off, and the more the knee starts suffering with simple everyday tasks. Your body was built to adapt to movement, in the right dose, the right way. And when you start small and stay consistent, it responds. Now, to be responsible. If you have frequent swelling, warmth, significant locking, pain that only gets worse, or intense pain that lasts more than 24 hours after walking, it's worth getting an evaluation with a doctor or a physical therapist who can examine your knee up close. Living with pain isn't normal, and you don't have to accept it as just age. Here on the channel, there are other videos with specific knee exercises and strategies to improve stability, so make sure you subscribe and turn on notifications. And if you want a more organized path with a ready-to-go progressive routine, I left the Knee Pain Relief Program in the first pinned comment. It's a great option for anyone who wants a step-by-step plan to reduce pain, build stability, and regain confidence to move without fear. Now tell me in the comments, which one has been your biggest mistake so far? Stretching to the limit, or trying to walk while your knee is still stiff and your muscles are switched off? See you in the next video.